Got a call from Linda yesterday saying, Kino, we're trying to get kids in Khayelitsha to brush their teeth. It's something I hated doing when I was young. It's certainly something that a lot of children don't see the value of. It's also something that parents lose sight of. You can't see, the bacteria crawling in between your teeth. You can't see teeth decaying unless it's really bad. So people tend to forget. Now, you know that you get your baby teeth, and then you get your adult teeth, and after that you need to get dentures. And a lot of people don't want to go that route. So Linda Greenwald in Cape Town joining us. She gave us a call yesterday. She's a dentist, and she was part of the toothbrush drive yesterday in Khayelitsha. Linda, good morning.
Good morning.
Why should we care?
We should care, first of all, because Cape Town has the worst teeth in the whole of the Western Cape, or the Western Cape, the Western Cape has the worst teeth in the whole of South Africa. Because people neglect the brushing, they think, well, if you have baby teeth, you're going to have permanent teeth, so why worry? And that's one of the reasons why it's neglected. The other reason is that the children go to sleep with juice in their bottles, and so when the bottle is resting on the front teeth, there's a lot of decay on the front teeth. It just slowly decays away.
Okay, now I want to go back to something you said earlier. You said we've got the worst teeth in the country.
They've undertaken studies to assess this. Professor Attila at the University of the Western Cape has assessed this and discovered that 5-year-olds have up to 80% of decay, which is absolutely massive.
Jeez.
Way beyond the norm for other countries. And so we then looked at ways, well, how could you improve that? What can we do? What we learned is that if you just tell the child, go and brush your teeth, they don't always do it, as you know, and they do it really quickly and rapidly. But we need to introduce a supervised brushing where the children actually do it at school. And so everybody keeps their toothbrush at school in a special way. It's all displayed. Every toothbrush is separated so they don't touch each other. And every day after lunch, the children go and brush their teeth.
Now,
and it's supervised by the teachers.
What do the teachers say to those children, though? You've got to brush your teeth. It's important to keep it clean and healthy, or do they use stories to get the message across?
We don't like to have negative stories. So if you don't brush your teeth, you're going to get holes, etc. But we like to focus on the positive, to have lovely, clean teeth that look nice and not any smell, that they're nice and healthy.
Yeah.
But really the fact is that the kids who have severe decay suffer so much. They suffer in pain for 3 years. And this is what I've been learning this whole week. The amount of suffering the kids have because they don't have access to dental care, and they suffer with their pain for 3 years because there's no one to help them, which means they can't focus at school, they can't concentrate, they're suffering in pain all the time, they're unhappy because they've got huge holes in their teeth.
Now give us a couple of quick tips, surefire tips that can help us assist those kids so their teeth can stay lovely, healthy, clean, white.
Okay, so first of all, we know that you have to actually brush for 2 minutes. The young children don't have to brush as long, but in general, the population has to brush for 2 minutes.
So not too many sweets for parents, or for the kids?
The sweets is a big issue because some kids eat sweets. They'll have one sweet this hour and another hour. They'll keep eating sweets the whole day, and that's when the major factor is. It's better if they're going to eat sweets to eat all the sweets in 1 hour rather than keep eating sweets every hour, because that's when the pH in the mouth drops, and that's when they're exposed to acid, and that's when they get more decay.
And no bottles, no juice bottles to bed. And as a parent, especially when they get older, I want juice. I want juice when I go to bed. I don't want to drink water.
Exactly. Well, the juice needs to be massively diluted, and if a child's used to drinking a lot of apple juice, you have to keep adding water each time so the child gets used to the less sweet taste, so they can reduce it.
So what we'll do is we'll put your details on our Facebook page. We'll put a link to your website as well where they can get those details. That's a dentist, Linda Greenwald in Cape Town.
I don't know if anybody can do it. Really? Yeah. But I mean, it's a big job.